Hello everyone and welcome back to the recent graduate programme on block dogs. This is part 2 where we're going to look at what diagnostic imaging is most appropriate for these cases. So I think the way I would start with a block dog is actually just a plain radiograph. I think that you get a lot of information from this and it's really useful to know what's going on, again as a bit of a baseline. So this is a radiograph of the dog that we were talking about. So this is a young male and tired bulldog which has got a urinary obstruction or dysuria. So already on this radiograph we can see that in the urinary bladder there is a sort of slightly triangular shaped stone in there, or something that's radiopaque anyway. I would say that the stone isn't massively radiopaque compared to the bone, so for me that will help us to narrow down our differential because we can clearly see the stone there against the soft tissues, but actually it's nowhere near as opaque or as attenuating as the bone surrounding it. One of the things that's really important though is that in this dog, in this plain radiograph, we can see that there is a stone in the bladder, but what we really want to know is why this dog is obstructed, because a single stone in the bladder may cause an intermittent obstruction if it goes in towards the neck of the bladder where the urethra comes off. But looking at this radiograph at the moment, there's no obvious cause of the actual obstruction. When we do see a urethral obstruction, especially from a stone, which is now what we're suspecting, we would usually see those at the base of the os penis, and you can see the os penis on this lateral radiograph. But one of the things that we commonly see actually is that the femurs are overlying the os penis. So ideally what you need to do is this sort of view where we've pulled the legs forward. I think this one could have been collimated slightly better because the os penis is sort of overlying the edge of the skin, which adds a bit of artefact, but actually already you can see you get a much clearer view of the base of the os penis there, and you can see whether there are any stones in there or not. For this dog, obviously we said the stone already is not that radiopaque, and for some of the stones they won't be radiopaque at all, and so something like a urate stone you may not see them at all on a plain radiograph. So one of the things that we then need to consider is whether we put any contrast in. So here's just a summary of the sorts of stones that we most commonly see in dogs. So the radiopaque ones are at the top of the list there, so the calcium oxalate and the struvite stones. Cysteine is mildly radiopaque, and so this already is making us think, could this be a cysteine stone because it's only mildly radiopaque? And then as I mentioned already, urate down the bottom are fairly radiolucent, so they're quite hard to pick up against the soft tissues. So what we'd often then do is either doing a positive contrast urethrocystogram, or like we're showing here, a double contrast urethrogram where we're putting air and contrast in. And you can see now that stone is highlighted even more obviously because there's air in the bladder, which is radiolucent, and then the stone now against the contrast that's in there, the iodinated contrast, you can see the stone is now radiolucent in comparison. So we can see that stone highlighted quite nicely. And if you were to take that radiograph when the contrast is in the urethra, that would also highlight any stones in the urethra and hopefully diagnose where this obstruction is coming from. I don't have the image here because we did it on fluoroscopy, but there was a stone at the base of the os penis in this dog. It just wasn't quite so obvious on the images. So as I say, we'd often start with plain radiography. Because we have fluoroscopy available, we will often use that because that gives you a dynamic, real-time image and you can actually see the contrast flowing past and get a little bit more information than you do just on the plain radiograph. But usually for these cases, we're not needing to reach for things like CT. Ultrasound can be useful to look at the bladder, so for this case you'd probably see that stone quite nicely, you get some distal acoustic shadowing, but you're not going to be able to image the whole urethra because of the os penis and because of the pelvis, so something as an adjunct, but actually radiography is the most useful for these. So in summary for this dog then, we've got a urethral obstruction from a urolith. It's likely to be cysteine, and that's based on a few things. Firstly, the radiopacity, in that we know it's only mildly radiopaque. And then there's other contributing factors that we've not covered. So bulldogs are predisposed to cysteine stones. There's also a link with them being entire males, and that's actually why we recommend castration for these cases. And also we would get some indication on urinalysis, although we've not included the results of that here. The Minnesota Urolift Centre, which is sponsored by Hills, has got some really useful resources. So I've just copied the URL there. So if you do click on that link and go on there, there's a really nice sheet for each of the different stones and the recommended guidelines as to how to manage these cases. So I think that's a really useful resource. And if you do get as far as removing these stones, then actually they'll analyse the stones for free for you as well, and it's free postage and so on. So do make use of that resource where you can. So for this dog, as I said, we've diagnosed this urethral stone. We know we've also got a stone from the bladder. So how are you going to approach this case initially? So we've currently got this dog that's blocked. We know it's got these 2 stones, so where are we going to go next? Join us for the next part of the video and you'll find out the answer.